Thanks very much. It's inspiring to be here tonight, and we're really quite excited, very grateful to TFN for inviting us, and especially to Undine Upton, our sponsor. I'm Ruth Copland, Chair of Women's Trust, and Catherine, the Director. Women's Trust provides free counselling and self-development group work to women who've been affected by domestic violence. There are a lot of people working in the field of domestic violence, and what makes us special is that we focus on what it takes to address the mental health issues to help women regain control of their own lives after the damage caused by abuse. We provide long-term support both through counselling and through the workshops and self-development work. Domestic violence is a big issue in the United Kingdom.
2 women a week are killed by their male partner or ex-partner. 1 in 4 women has experienced domestic violence, and 1 incident a minute is reported to the police. It affects women of all classes, cultures and backgrounds. Domestic violence has a huge impact on mental health. This kind of abuse is the biggest cause of depression and other mental health difficulties amongst women. It is associated with suicide attempts, alcohol dependency and other substance misuse, as well as post-traumatic stress disorder. And it affects the children of the relationship, passing through future generations. At Women's Trust, we address women's mental health needs by providing counselling and self-help groups. We provide high quality through the expert training and supervision of counsellors who are specialists in the field. We're low cost and we use volunteer counsellors, most of whom require the client contact hours to complete their counselling qualification. This leads to a win-win situation. Counsellors then go on to practice and utilise elsewhere the experience and skills they have gained with Women's Trust. We work in partnership with other organisations, which is crucial to providing a joined-up service to the women that we see. But what makes us special? Well, to begin with our quality, we offer up to 18 counselling sessions per client. We're person-centred, meaning we're client-led and non-judgmental. We're specialists, not generalists, with a huge amount of experience. We use counsellors who are carefully selected and supervised, and we offer self-help workshops to follow up. In terms of our accessibility, we're free and we're local in the community. Our ethos is that we're driven by our belief in empowering women, determined to help, totally committed to meeting the needs of our client group. How do we know we're successful? Well, we know we're successful because women tell us every day. For example, Joyce told us,
I can smile more and enjoy myself. I don't feel agitated at work and now enjoy seeing people around me. I can now sit and have fun with my daughter. I now find that my confidence in relationships is increasing. I don't feel unattractive anymore. I now love myself and appreciate the good and bad in life. I feel I've got a chance.
Each year we support over 1,000 clients via our counselling and group work. The feedback we receive shows that most women experience significant change as a result of their interaction with our services. We know that women often feel more in control of their lives and able to make their own decisions, which can involve taking steps to make simple changes like studying or finding work. On average, our clients rate the most significant changes as improvement in their own self-care and knowledge of their own rights. Other areas of improvement include decreased feelings of isolation, decreased levels of stress and anxiety, increased confidence, better rates of interaction with others, improved relationships with their own children, awareness of services, and feelings of renewed control over their own future.
Women's Trust is very proud of what we've achieved, and as a new trustee, a relatively new trustee, I've only been with Women's Trust for a year, I feel very proud to be associated with Women's Trust. The trustees and Catherine have been looking at ways that we can increase our impact and our effectiveness, and we've embarked on several strategic initiatives, including the one that we hope that you will support tonight, and that is to share our model of service to women with other agencies and providers. If we're going to do this, we need to invest time in preparing ourselves, time to understand other agencies' objectives and to understand what tailoring of the model might be needed. A lot of that time will be provided free. We're asking you to fund the time of our director and administrator. Our aim at the end of this project is to have a soundly researched list of agencies who are willing to adopt our model and to be ready to go and speak to them without wasting their time with something that they can use. Our ultimate aim is more people adopting our model and more women enabled to rebuild their lives, more people who can say, like one of our clients,
I was in such a desperate state and they rescued me from complete despair. The service helped me to reconstruct my life.
We're delighted to have had the opportunity to say this to you tonight. Please help, and thank you very much.